Hello, and thank you for joining us for Season 3 in Inside America's Minds. Today I have with me Dr. Teresa Seggerman, veterinarian. Dr. Teresa, thank you so much for being here.
Thank you, Jody. I really appreciate this opportunity.
It's a privilege, I'm telling you. I was so excited when you agreed to go ahead and do the interview. So you're extraordinary. There's no question about it. I'm reading through all the notes. And so, very interesting. So, you're a graduate from CSU, Colorado State University, right here in Colorado. And you focused well, let me go back to it. So, at 4 years out of high school, you joined the military. Is that correct?
4 years out of veterinary school, yes.
4 years out of veterinary school, you joined the military. Thank you for your service, by the way.
Thank you.
And you actually joined the U.S. Army Veterinary Corps?
Yes.
Okay. So what does a military veterinarian do?
Well, that's dependent on the service. And the reason I chose to join the Army was the Veterinary Corps actually allows us to practice as veterinarians. That's unique among the service branches. In the other branches, we serve in their public health units, not as veterinarians. In the Army, we help offer veterinary care to military members and their dependents on bases inside the United States and across the world at our military bases overseas.
Mm-hmm.
We are in charge of performing inspections for food services in facilities that sell to the United States military. So we're going in and making sure that they're meeting sanitation expectations so that the food that comes to us is safe for consumption. We have the lovely job of inspecting MREs, the meals ready to eat, to make sure that they're still edible
Wow.
based on expiration date. We unfortunately do not have the ability to change how they taste or which ones are made. That's a different part of the military that does
You're
that.
talking about the rations, right?
Yes,
Yeah.
yes. We had people who were like, please make this one go away. And I'm like, I wish I had that power. I don't.
So you did a lot of different things, and then I was amazed to find out. So after the service, you actually worked in emergency medicine, veterinary medicine, correct?
Yes,
In 15 years in the Denver area. I mean,
yes.
all of us who have worked in an emergency room know, hey, burnout is there.
Oh, yes,
So
very definitely.
I commend you. It's incredible. You own 4 cats, and I love when you said you are proudly owned by four
Yes.
cats. And I love that. And their names are, tell us, Egbert.
Egbert, Kea, Willow, and Soji.
Okay. All right. Now we're going to really get down to business. You're also a philanthropist. You're a humanitarian. You're a musician. I listened to the YouTube and I listened to your interview, your YouTube filming with Arvel Bird, who's an incredible Celtic Indian musician, by the way. I mean, you do it all, and you do so much on a community level. We mentioned Toastmasters when you and I talked before, but there's so many more things that you do. A fascinating life story. And like I said before, nothing ordinary about you. So let's go on. Let me see. I've got lots of notes. Do you miss the emergency room? I got to ask.
No, I like sleeping at night at this point in my life.
Okay. All right.
I
And currently, you work in Dr. Sally Towner, who I've known Dr. Sally for over 10 years now. She's the owner of Erie Animal Hospital. She's a phenomenal human being and veterinarian. And you work with Dr. Sally, and also there's Dr. Kathy Gagliardi there as well.
yes.
And the staff you have, I mean, I know they're patient with me because I'm also a client. You've got an incredible staff, and Erie Animal Hospital, my gosh, they're very dear to my own heart. So I'm so glad you are part of that wonderful team. What exactly does a veterinarian do?
Depends on who they're working for. Veterinarians actually have the ability to work in a variety of jobs, from research to, say, government, working for the USDA. They work in the military. There's private practice, there's corporate practice. We work in marketing for veterinary products, as well as human products. You're actually, as a veterinarian, limited only by your imagination.
Wow, that's
It
kind of like a
applies to
psychologist,
so many
actually.
things. Yes, it really
Wow.
does.
And so, what are the biggest challenges that you think there are as a veterinarian?
That again depends on what you're doing for a living. As a
Okay.
private practitioner, my biggest challenge is providing the very best care I can for patients within restrictions placed by the owner's budget, and
Hmm.
their desires. I mean, I can't place a judgment on what a pet means to any other person on the planet and would never dream of doing that. So it becomes a conversation to find out, what does the person want for their pet? What can they apply? What can they provide? What fits their lifestyle? All of those things come into play. And that daily dance, I think, is part of the hardest part of the job, because you have to pay attention and make sure that you're doing what works for the owner and the pet, not necessarily what you want to do.
Okay. So, this was very interesting to me. The stereotypes of veterinarians. Um, you had told me what you think what they are, and then I was particularly interested in the stereotypes, especially from a psychological perspective. But can you talk about the stereotypes the general public has for veterinarians?
Overall, I think veterinarians are still among the most trusted people on the planet, right up there with doctors and nurses.
Okay.
We believe that our medical professionals are there for us or for our pets. So that makes sense. People believe we're considerate and empathetic, and um, we're in it for the pet. And then there's the flip side of that, of people who are frustrated because we still run a business. We still have to make enough money to keep our doors open.
Mhm.
Being told that I'm in it for the money always hurts. I
Oh,
don't drive a
yes.
Lexus.
Oh,
I honestly, I am there for the animals, but we also have to make enough money to keep our doors open. And
right.
I understand that veterinary medicine is as expensive as it is on the human side, and insurance is not there universally like it is for humans. So there's that delicate balance between desire and needs, on both sides, from both the perspective of the owner and from the perspective of the veterinarian.
What interests me is because I have the privilege of working with a lot of veterinarians, and I've done a lot of research in the psychological aspects of different disciplines within healthcare, including veterinary medicine, is veterinarians have a high incidence of depression, anxiety, and you had even mentioned it, of suicide. Why do
Yes,
you think that is, Dr. Teresa?
there's a lot of reasons behind that. We are, by definition, very giving people. We really want to help. And unfortunately, some of us don't have great boundaries. So we have a hard time separating ourselves from the needs of our patients and our clients. For a long time in the veterinary profession, they chose people who, performed well, got great grades, were very focused on, I'm going to meet my goal. And that puts performance anxiety into the picture, because we're constantly holding ourselves to a standard that is inhuman. The veterinary profession has figured out that they really need to look for candidates who have a very broad view of the world. They've gone out and done things other than study. They've gone into sports, they've studied music, they've taken classes that have nothing to do with veterinary medicine. They've learned to become well-rounded human beings. And because of that, we're starting to see a change in how veterinarians deal with the world. And I think that's an awesome thing, because losing colleagues because
Mm-hmm.
they just feel like they're not doing enough when we're all doing more than is humanly possible, some, on a lot of days. To feel like we're failing when we're actually succeeding is something that puts us at risk for depression and anxiety, and unfortunately, in some cases, suicide.
Yes, yes. What is one thing most people wouldn't know about veterinarians in addition to what you've just shared with us?
Hmm. We're all really super stressed out.
Okay, okay, fair
um,
enough. The best and worst aspects of being a vet.
oh, the best aspects are that joy that comes from helping a patient back to health and being able to reunite it with its parent, and just
Mm-hmm.
that human animal bond in action. There is a joke in the profession that we all wait for the days when we get to see new puppies and kittens. And yes, we do. Not just because they're puppies and kittens, but because there's that joy and excitement in a new bond, and we know we're not going to find health problems, so we can just
Mm-hmm.
go in there and enjoy the experience. That is by far one of the best things about it, the human animal bond. uh, the worst part of the job is having to give bad news to people that
Mm-hmm.
we've got a serious problem here, and it may not be a fixable one, or it's an expensive one. And watching people go through the process of making really hard decisions about, what do I do for my pet, what's best for me and my pet. And it's heartbreaking, and we've been there ourselves with our own pets. So it takes a toll, definitely.
Uh, I know in our field we see that, but in a different way than you do. And again, I commend you. I commend the profession of veterinary medicine. What is the most threatening situation you, Dr. Teresa, have been in as a veterinarian?
Well, I worked in ER medicine, so there's the situations of people coming in off the street who weren't normal, had either imbibed in alcohol or drugs or
Okay.
whatever. But honestly, my scariest experience actually happened my first year in veterinary medicine. I was working with a patient trying to do a vaccination, and it turned around and lunged at me, and I felt its teeth snap right next to my neck. And at the age of 25, to see your life flash before your eyes
Oh,
because you
wow.
realize how close you are to death, that's the scariest thing I've ever dealt with in veterinary medicine. The people don't register as high as that one scary St. Bernard.
Yeah. Yeah. Oh, it was a St. Bernard. Oh my gosh.
And,
Wow.
it honestly, it wasn't the dog's fault. He had never met a white person. He had come off of the middle of a reservation. He'd been surrounded
Okay.
his entire life by a different culture. I was different. I smelled different. I acted different. I talked different. All of those things were things he didn't know how to deal with. And then I tried to vaccinate him. So it's understandable, but it was still a terrifying experience at the time.
Wow. And just bringing up the subcultural and the cultural differences with animals, I wouldn't have thought twice about that. With humans, it's a very real thing. But yeah, I guess it would make sense. A totally different environment, different visual, different smell.
Mhm.
Wow. Psychological aspects of being a veterinarian. What about them?
There's a lot of stress.
Okay. Yeah.
Just it's the balancing of all of those different aspects of meeting needs for patients, meeting needs for clients, um, caring for your team members, um, the busy job that we're in, sometimes things feel like they're out of control and you're either juggling or you're trying to be the ringmaster. Then, as an associate, I don't have to deal with the management side of things, but there's that hat as well. The ownership hat for my boss, of having to keep the business running as well as practice medicine and make sure that the team works well. It all adds up to just trying to keep your chickens in a row. There's a great video out there on YouTube of herding cats. If you've never seen it, check it out. I think it's a great way of describing our job.
Okay, herding, Herding.
Yep. It's a
Okay.
bunch of cowboys herding cats. It's
Okay.
awesome. Gotta watch it.
Okay. If you had to do it all over again,
Depends
career
on,
wise, I know
honestly.
what you I
It
know
depends.
the forest ranger's up
Yes.
there,
It
but
depends. It depends on the day.
yeah.
My career counselor told me I should go into forestry,
Hmm.
which would have been an ideal job for me. It was outside. It involved plants. It involved nature. I mean, it would have been a great job for me. Veterinary medicine was a reach for me, and at the time, I didn't know that. I grew up in a very sheltered community, had very little access to people outside my own culture. I had a lot to learn in order to become a veterinarian. I've learned to be an extrovert, and as an introvert, that's exhausting.
Oh yes.
I had
Yeah.
to learn about other cultures. I had to, learn to acknowledge that other people see the world differently than me and see animals differently than I do. Yeah, honestly, I would do it again. It has been richly rewarding, horribly exhausting at times,
Mm.
but the person that I was is anywhere near the person that I have become.
Wow.
And if I hadn't become a veterinarian, I would not have had all of the experiences I had, and I would not be the person I am today.
It's nice to hear you say that, and you're still very passionate about your profession. Let's talk about some fun questions that all of us ask. Okay, do dogs see in black and white or color? Do cats see in black and white or color?
They both actually see in color. Dogs have the same rods and cones in their eyes that we have. They don't see as brightly as we do. So, what we would see as bright pink comes across kind of as a mauve or muddy purple, not a bright color like we see it, but they definitely can see color.
Okay.
Cats actually are more talented than most animals on the planet, because I still believe they're aliens and have come from somewhere else.
A little
But
bias there, Dr. Teresa. Just a
uh,
little.
I love my cats, but I do think they're aliens. The really cool thing about cats is that they can actually see into the ultraviolet range,
Wow.
which we can't. So if you find your cat staring at something and you're like, there's nothing there, it's because they truly can see things that we physically cannot see. They are not always nuts.
Okay. See, I have a little wiener dog that does that, but he's old. So I'm wondering if I need to.
Well, it could be they see beyond our range too. I just
Hmm.
know that when we found out cats could see into the ultraviolet range, we're like, wow, that's just amazing.
Wow. So the strongest sense for dogs and the strongest sense for cats.
Cats, it's probably hearing and sight more than anything.
Hmm.
They don't rely as much on their nose as dogs do. The vast majority of dogs, it's their nose. However, we do have some breeds that actually use vision, like our sight hounds. Think like greyhound type breeds.
Hmm.
Their eyesight is actually far superior to their nose. So it's a lot of it has to do with breed there, but by far it's the fact their nose is 10,000 times stronger than ours.
Would that be like, I know with some of my clients who have seizures, they have actually trained seizure dogs who give them a sign, because I guess they sense the change in physiology and the smell right before their
Mhm.
master goes into a seizure.
Mhm.
Is that the same with cats? Can cats be trained to do the same thing? You're laughing. Okay, you got to tell me
I'm
what's
sorry.
going on there, Dr.
Yeah, the
Teresa.
answer is yes, cats can be trained to do those things, but most cats don't give a damn.
Okay.
Yeah.
At combat dogs, dogs that are used in military service or even law enforcement, how are they different?
It's their breeds are chosen for the drive to do the jobs that we ask of them.
Okay.
It's it comes down to heart. They want to pursue, they want to perform. They're passionately loyal to their handlers. All of those are things they have to have prior to going through training. And then it's training, years and years of training to do the tasks we ask of them, and to expose them to the experiences that they're going to face before they face them. I mean, soldier, whether a soldier is a human or a dog, they need to know how to do the job before it comes down to doing the job under fire. So it's really about training.
Okay. And I really, uh, I'm amazed at how they are honored when they are shot in the line of duty. Yeah, that just breaks all of our hearts as well, especially the handlers. Yeah, I
Yeah.
like the ceremony that they have and honoring
Mm-hmm.
these incredible pets and service animals.
Mm-hmm.
Okay. PTSD in animals. Of course, you know, as a clinical psychologist, I'm going to be very interested in that. And I have my little rescue, Dave,
Mm-hmm.
and I believe he has some conditioned response, post-traumatic stress because of an earlier environment. Can you talk about that? PTSD, post-traumatic stress in our animals.
As a scientist, we would say PTSD isn't a word we can apply to an animal
Okay, why?
because we cannot communicate with them on a level that we can say it's the exact same thing we're dealing with as a human.
Okay.
That being said, there definitely is a trauma response in animals, whether we give it the same name or not. We use PTSD because it's something that we recognize as humans, and we all know what it means. So I can talk to a client saying, this is PTSD. It's not the official term in a dog or a cat, and it doesn't matter.
Okay.
We're mincing words there.
Okay.
Yes, trauma affects them the same way it does us. Repeated traumas lead to the same changes in the brain, the same guarding that we see in humans. It
Mm.
very definitely, we see animals who have learned to anticipate what they consider to be dangerous situations. And it permanently changes them, leaves them needing help to overcome their anxieties and learn to function in a world where they have learned not to trust and need to relearn trust.
Can that behavior or that hypervigilance, fight or flight, be repatterned or reconditioned through desensitization like we do with humans?
It can. It's harder to make the connection because we can't verbally talk to a dog and explain to them what they're going through. I can't
Okay.
make that connection like I can with another person. Uh, you know, but with work and constant reinforcement on the pet parents side, we
Mhm.
can make those changes and then teach them to generalize to the rest of the world.
So I find it interesting that the same medications, psychiatric psychotropic medications we use in humans, many of them are used with animals. Can you talk a little bit about that?
There are actually a handful of drugs that we use routinely in dogs and cats to help with anxiety and stress behaviors.
Okay.
We don't honestly know how they're working in the brain
Mm,
because neuroscience, both on veterinary side and human side, is still the last frontier. We do a lot of
okay.
things with the brain that we just honestly don't truly understand. Uh, that being said, we do definitely take advantage of those drugs because they improve our pets' lives when they're dealing with stress or anxiety. And one of the coolest things about working at Erie Animal Hospital is I'm in a fear-free practice now. So we
I
work,
read that.
yeah, we work very hard to help our patients see the veterinary clinic as not the most horrible thing that ever happens in their lives, and let them try to bridge that gap by helping with anxiolytics so that they can learn to appreciate that we're there to help them, and it's not just you're going to come in here and bad things are going to happen. On the dog side, anxiety is a big deal. On the cat side, cats don't ever go anywhere except their groomer or their vet. So when you put them in a car, they know where they're going.
Yeah.
Poor things. Nobody takes their cat. Well, some people do, but it's a small percentage of people who take their cats out, for like backpacking and trips across the town and stuff. And so cars become associated with veterinary clinics for a lot of cats, and it makes it hard for them because you get put in the carrier, you know exactly where you're going. You got to get in that scary car that moves and does weird things, and then the end, you get to meet your veterinarian again.
What do
So
you recommend for cat owners? I had a cat many years ago, and I mean, he was one step short of being sedated every time we went to the vet. And now I'm like, well, this was it. It was the car that was probably, well, the crate and the car that may have been the association. But
all of
what
those
what
things,
what do you
So
recommend?
I tell people to start with a carrier that does not live in the closet until it's time to go to the vet. Your carriers should be part of your household so that your cat actually associates them with good things as well as bad. Um, there are pheromone sprays that we can use that decrease anxiety. Those can be put, is sprayed inside the car or in the carrier before the cat gets in it. It just helps the cat calm down. They're based on a pheromone produced by mother cats when they're nursing, so it makes the brain just really a happy thing.
Is that like the Adaptil?
Yep.
Yeah.
And in
Okay.
cats, it's called feel away. But yes, it really does help. Um, I've been told that cats really appreciate classical music. So playing classical
Okay.
music in your car while they're traveling to the vet can help. But again, it's really about desensitization, making, you know, more frequent trips where the cat basically just drives around the block, comes home, gets out of its carrier, gets a snack, gets to go curl up in the sunshine and do cool things so that it doesn't think that the only time it ever gets in the car is that it's going to the doctor. And for
Okay.
the ones who are really, really anxious about that, we also do have medications that we use. The number of meds that we have available for cats is actually smaller than dogs because they're not just little dogs. They have a different physiology, and
Mm.
so we have to use different medications with them. But there are definitely things that we can do to help make that whole process easier so the cat doesn't think it's going to die when it gets to the end.
Okay. I know a lot of humans when they go to the lab before they get there feel the
Yeah,
same
I
way.
know.
Or
It's
the
like,
white,
oh,
the doctor's office, the white lab coat effect. So if you can generalize, what is the biggest fear that domesticated animals may have? Pets, I guess we
yeah,
could say.
yeah. I mean, for pets, we meet their basic needs. So the vast majority of them, I don't think, have a lot of fears that that they deal with on a regular basis. They live in the moment. They're like little meditators all the time, um, which is awesome because they're not anticipating things constantly. That being said, a lot of pets end up with anxieties because there's something stressful in their environment that the owner doesn't recognize as stressful. It's really hard to get a cat to tell you what's stressing it out because they don't stress over the same things we do. Um, Anxieties over things like the parents leaving the house and then not knowing when they're going to return. I think separation anxiety goes on the top of the list for a lot of animals.
Yeah,
Less of a cat problem than a dog problem.
right.
Cats are actually really good at just taking care of themselves and then thumbing their noses at their parents when they come home, like, "Oh, you're back. Where's the food bowl?" Yeah, my cats are laughing at me as I say these
As you
things.
talk. And dogs, I think, are more dependent. I think one of the greatest things for pet owners, and I know with dogs, I've had dogs all my life, is when I come home, the greeting is
Mhm,
just so incredible. I'll
mhm,
I'll turn to my son and ask, why don't you greet me that way? Why don't you know? It and that talks about, that leads into my next question is the human animal bond.
mhm.
Talk a little bit about that.
Well, this is honestly the reason we domesticated these animals. I mean, we've domesticated a lot of different animals, and most of them you can look at them and go, okay, we domesticated them so we could use them to help us do our jobs or to provide food. Dogs and cats don't fall into that category. Nobody wants to eat their dog or their cat. We basically domesticated these creatures to provide us with companionship.
Mm.
And some of the coolest things about that is they never ask for your car keys. They don't have to go to college. Um, People say, I don't understand why my wife loves the dog more than me. Well, because it's unconditional. Their love is
Yeah.
pure and unconditional. It's the same kind of love you get from your mother when you're a kid. And that bond is very special. And it's hard to get that from humans who are adults because we all have our own lives and we have our
Mhm.
own perspectives. And cats and dogs, just that it's all about love. It really is. Most people would laugh at me now because cats don't give love as well as dogs because it's really where we're serving them. They are the gods. But that bond is about pure love.
And
And
I'm going to ask you a question related to that later that I get. Many of my clients will ask me. So, rescue pets. I've had two and have one now, and I really believe they're different in some way. What do you think about that?
well, it's hard to generalize because we don't know the history, but a lot of those animals didn't get the love and socialization they needed
Okay.
when young. There's that window of socialization in both dogs and cats that lasts up to about 16 to 20 weeks, where the bond with humans is the easiest to form because they're growing their brains at that point. And if their interactions with humans at that point weren't good or weren't consistent or didn't happen at all, it's hard for them to make a connection with
Mm.
us. So, rescue animals, you're getting a gift and you don't know the hidden surprises. And it can be difficult to make a bond with a pet like that. It takes longer. That
Yeah.
learning still occurs, but doesn't occur as easily. Um, and so it takes more work and more patience on our side. The rewards are huge when you break through and your pet truly bonds with you and you're like, yes, we are one. This is my dog loves me. Is awesome. I don't adopt just puppies and kittens myself for that very reason, because rescues need help too. But then you have to teach them how to interact with the world. And it's
Yeah.
a lot of work and it's a lot of reward too.
The process of euthanasia. Tough one.
It is, but it's also a gift. It
Okay.
truly is. Um, I it, it's it gives us the option of letting our pets go gracefully. And I wish that it were more universally available for humans because,
Hmm. I
you
agree.
know, to not have to struggle at the end is such a gift. Um, it's harder when it's a young pet and they didn't get the life that we expect them to get. You know, they didn't get to old age. Um, but to share in the process of grieving and saying goodbye and letting go can be richly rewarding as much as it is emotionally painful for veterinarians and their staff. I don't, I would hate to lose that ability to be able to let animals go gracefully. Um, and I would never avoid it. There was a time when it hurt a lot more.
Okay.
When I was in the ER, I did a lot more of them because pets come in crisis. Um,
Yeah.
and it added to the stress and the pain of my job. Now it doesn't hurt so much because it isn't so frequent. Still hurts because I'm losing a pet I love as much as the owner does. I'm losing a friend. But to be able to help people, you know, let their pet go gracefully is an awesome responsibility, and it's a grace.
Do you think our pets give us a sign that they're ready to go?
Sometimes it depends on the pet, it depends on the bond. It's very individual.
Okay.
Um, and I say that because I don't want anybody to think that they missed the sign,
Okay.
because it is such an individual thing. Making that choice for a pet owner is very, very difficult.
Yeah.
Um, as a pet owner myself, it is very difficult. And every time I've done it, it's been different. So there isn't a thing you can look for. I tell people when they ask me, how will I know?
Yes.
To sit down and make a list of the 5 things their pet loves to do most, whether that's sleeping, eating, chasing a ball. You know, just think about your pet in the middle of its life. What were their favorite things to do? Are they able to still do those things? As the number of those things drops away that they can't go and do and enjoy, your quality of life is lowering. Are they able to get to food and water and go to the bathroom without difficulty? Those are quality of life issues for any animal. Can we control their pain? uh, you know, do they feel safe in their environment? That's an individual one based on the other pets and in the house, because when you're a 17-year-old cat, I'm going to use my Egbert as an example.
Egbert.
uh, my Egbert, he was very upset with me when I brought kittens into the house. He's like, I don't want to be the bowling ball. I'm 17. I don't want a kitten running over the top of me. So I actually ended up getting a second kitten so the kittens would torture each other and not the old man. He's also told me he doesn't want a dog in the house because for the same reason. He says, you know, he's old, he's arthritic. He has the right to finish out his life without being used as a ping pong ball. That's a choice that I've made because I want him to feel secure
Mhm.
in his aging years, that he can get around, he can do the things he wants, and nobody is going to come and maul him when he can't get away from them. So there's a lot of things that go into quality of life, and I encourage people to talk to their veterinarian about that, have that conversation, get the feedback on what what they're seeing that we don't see because the pet's right in front of us. You know, you can't see the forest for the trees thing.
Right.
Yeah.
Right.
It's okay to ask your veterinarian about quality of life. It's okay to have multiple conversations about that, so that we make sure that we're taking care of the pet's needs and they're not lingering too long.
I know there's a lot of, like you said, the emotion involved as a pet parent to make that decision is so difficult. Um, I had my experience with Dr. Sally with our corgi, and I have to say she was just incredible because I asked her, "Is it time?" And she looked at me, what do you think, Jody? And we talked through that. And in the end, it was my decision. But
Mhm.
without that support from somebody I trusted, who had the best intentions, I don't know if it would have been as smooth a transition. And then the privacy, just being able to hold your animal in those final moments. But it must be so difficult for you as veterinarians when a pet parent asks you, "Is it time to let my pet go?" How do you answer that? What do you think about that, Dr. Teresa? Oh, wait, I got to see the mug. Those of you who are hearing, you can't see this incredible cat coffee mug. All right, I love it. I love it. And I like your ink, by the way. I saw that too.
Oh,
We
yes.
clinical psychologists, we don't miss a whole lot. All right. You are a force of nature. I told you that. So when you are in that situation with a pet parent and they ask you that, how is it handled? What are your thoughts? What is your position as a veterinarian?
Well, I was taught as a veterinary student not to personalize that, not to get involved in that conversation. And I know my teachers had the best of intentions, but at this point in my career, 30 years out, I dropped the doctor's hat and talked to him as another human being.
Okay.
I literally talked to them about what it was like for me, what goes through my head when I make those choices. I don't make the choice for anybody. I can't. They have to do that themselves. But I am very open about the process and the pain that I get involved in when I have to make these choices and the things that I consider important. That's that list of the 5 things that my pet is.
Thanks.
Yeah, it really helps. I think it helps them put a handle on what their pet considers important, um, so that they can balance that with what they consider to be important, which is never losing their pet. In a perfect world, our pets would never die.
Yes, that's what I hear so often from
Yes.
clients. Yes.
But um, we all, as adults, know that that isn't going to happen, and we want to make the best choice. So
And that
I have,
touches you. You're feeling that now. I can see it. And that's triggering your own history with loss and grief.
and
Oh,
and then knowing that they're not hurting anymore. But yes, I have gotten to the point where I'm willing to have those open conversations, and it doesn't hurt me to do that anymore. Um, Going through and facing the griefs that I dealt with as a child with my pets,
mm,
helps me because now those burdens don't come back to haunt me anymore. Um, and
mm.
I think that was actually the point where things went from this is really painful and I don't know what to say to okay, I've processed grief myself. I do know what to say. I can say
Wow.
these things and I'm not influencing, I'm just honoring the journey for them and for me.
One of the questions I get a lot too is, why do I hurt more and grieve more for the loss of my pet than I do a family member, a friend? You tapped on it before. You addressed that unconditional love. Can you talk a little bit more about that, because it's such a common question? Why am I grieving more for my pet than I have a human? What's that about?
And why do people say it's just a dog?
Oh, I don't know. I have everything, no, from cats, but I have
Oh, I
one.
know, but a non-pet owner will be like, "Why are you still crying? It was just a dog. Go get another one." Yeah.
Oh,
Mhm.
yeah. It's a
Um,
different relationship with animals, I guess. Also, with makes you question their relationship with people too, though, in general. But okay.
they carry all our secrets.
Mm,
I mean, your deepest secrets, the things you would never tell a human, you will tell to your dog or your cat. They hear those conversations. You have them. Egbert knows all my secrets. Thank God he can't talk. Oh, yeah, I would be in a lot of trouble if my pets could talk. Um, so yeah, I mean, definitely you're going to miss that because no matter how badly you're hurting, you can always go to your pet and your pet will be there for you. Um, and it is a rare human that you can say is there for you under any circumstance
yeah.
because they're dealing with their own journey. Um, and so I think that's why it's so much harder to lose an animal because we do share so intimately with them. They carry our hopes and our dreams and our secrets and our pains. And when they're gone, there's that huge gap because we can love them unconditionally just as they love us unconditionally. It's hard to
Mm.
love humans unconditionally.
It is. Yeah. And the animals sense our moods too, don't they? And they
Oh,
feel
yeah.
us. They
Oh, yeah. When I come home and I've had a tough day, I have 4 fuzzballs on me. I can't get rid of them at that point.
yeah.
And it's yes, it's like they're my little energy sinks. They come and they pull all the ugly away,
Yeah.
take it on themselves, and then I feel better. So yeah.
Do you
Um,
find yourself having conversations with them like you would humans? I do. I mean,
and they're the perfect audience. They never talk back.
uh,
And if they
uh,
do, I can pretend I didn't understand.
yeah. So emotional support animals.
Mhm.
I think it got out of hand. I actually do thorough evaluations for people who do meet the criteria. That there's a lot of assessment involved. It's not just they want a ticket to bring the pet here or there. These are individuals where having that animal truly enriches their life overall, and they need that animal for whatever it may be, anxiety, depression, what post-traumatic stress. What do you think about emotional support animals? I'm not talking about therapy animals. I'm
No.
talking, and if you could just tell us briefly the difference between emotional support animal and a therapy animal, because there are those state and federal differences between the two. But what do you think about that?
That is a great segue from the last question where we were talking about that huge human animal bond. These animals are able to help people deal with their anxieties or stressors in a way that another person can't do. They play a vital role in those individuals' lives. Um, and there's been a lot of kickback in a variety of areas. And my frustration with it is you can't walk in another person's shoes. You don't know what they need.
Mm-hmm.
Um, you tell me you have an emotional support animal. I'm okay with that. The federal regulations are clear, though. An emotional support animal doesn't get any um, special dispensations in public. They don't get free flights. That was actually the biggest problem we faced. And the reason
Yeah,
for the
yeah.
controversy is therapy animals are animals that are specifically trained to do a specific set of tasks for an individual, whether it's helping them with their mobility, or sensing a potential seizure, something like that.
Mm-hmm.
They have specific training. Emotional support animals are just animals that people have bonded with who make them feel better when they get into a stressful situation and they need help to cope. Um, and any animal can qualify as an emotional support animal, apparently even a peacock.
I was just thinking of that. You
We
read
all
my
remember the
mind
peacock.
because that was, I think, when the woman brought the peacock on the plane as an emotional, I thought that was carrying it. I didn't know the woman. I don't know the history with the peacock, but as a veterinarian, I mean, I know they're used as,
I mean,
analogous to
birds
guard dogs, but a
birds have the
peacock?
ability to be an emotional support animal.
Really? Well, I know parrots and other
Yeah,
birds, but a
but
peacock?
I didn't meet the peacock. So, but the thing is that she was crossing the border between therapy animal and emotional support animal,
Okay.
and we just needed clearer guidelines for
Mm,
the airlines so that they can accommodate the process, but don't have to bend over backwards and get silly about it.
okay.
Therapy animals usually fall into specific species, mostly dogs, sometimes small horses.
Yes, yes.
Yeah, very specific. Emotional support animals run a spectrum of species. But to ask the airlines to make accommodations for things like peacocks and reptiles and animals that could potentially scare the crap out of a bunch of passengers is a different picture. That being said, if the peacock helps mom, then I'm thrilled that mom and the peacock have a bond that's helping her. But to ask it to be allowed on a flight is a different picture. Yeah.
Do does our relationship with pets change over our lifetime? As our lives change, do our relationships with pets change?
It has for me. Um, I've had pets in my life from birth, and as I have aged and chosen a lifestyle where I'm essentially mostly by myself, my pets have become more and more important to me, and the fragility of life has become
Mm,
more apparent to me.
yes, yes.
Knowing that I'm only going to get a certain number of years with any of my pets is something that I'm more aware of.
Okay.
People who grow up without pets and then learn about pets and get one, get that jolt, that jump start of this is an awesome relationship, and um, that will morph over time as well. So getting people who didn't grow up with pets hooked on pets is a great love of mine.
And I again have the privilege of working with people who have had such a bond with their pets. And some of them will say, I'll say, like, after they lose a pet, after even years go by, I'm like, have you thought about possibly getting another pet child? And it's like it's too painful. The loss is too painful. I can't go through that again. And people do that with relationships too after a loss.
Mhm,
It's just too
mhm.
painful. What would you say to those individuals when they say, I can't do it? It's too painful. The fear of loss, of losing that pet again. I don't want to re experience that.
I'd honor it.
Okay.
Some people go out and immediately replace the pet because they need to fill the hole in their heart, knowing that it won't be the same. And that's a
Okay.
choice. Um, Making the choice to not get another one is a choice as well. And I see it more in our senior citizens that they get to a certain stage and they're
Mm,
like, I don't want to get another pet. And it's not the fear of loss so much as the fear of what happens to my pet if I
right.
pass, and not wanting them to face uncertainty as to what's going to happen with the rest of their
Yeah.
life, because
Yeah.
they don't have a family member who's willing to say, regardless of what happens, I got you back. Your pet will become my pet, or I'll make sure your pet
Mm,
is taken care of. Um, you know, the fear of loss is a tough one, and I would never try to talk someone into getting a pet if they're not willing to deal with that.
okay.
Um, that's actually more your purview than mine.
Mm. Yeah, well, we talk through it. It's,
Yeah, yeah,
ultimately it's their decision. And if there's a void, an emotional void, how else can it be filled? But
right.
big thing. Okay, here's a question I have to ask because with humans, it's a phenomena. What is or what was the veterinary ER, but what is the practice, Erie Animal Hospital under a full moon? Do you see the same phenomena as we do in behavioral health and in medicine?
Yes, we do.
Okay.
I realize the scientists say it isn't real, but yes, I see changes in animals, my own animals,
Hmm.
other animals, their parents, when the moon waxes and wanes,
Yes.
or based on yeah, it definitely is there.
Do you think it's the change in the physiology, just like with the tides and so on? I mean, there is. I
Yep.
mean, it can also almost be predicted. Or I notice here in Colorado at altitude, when the barometric pressure changes, or even at sea
Mhm.
level with the storm coming in, animals, uh, there's just like humans, a change in behavior.
Yeah,
Traffic patterns, you see it all the time with humans, and just from behavioral health perspective. But so,
we're beings of energy. The
okay.
things in
Yeah.
our environment that change us energetically are going to affect us, whether we wish to acknowledge it or not.
Mhm. I agree. I agree. So, the pandemic, the COVID-19 pandemic, the role of pet adoption and pet purchase. What did you see?
We ran out of pets for people to adopt.
Okay. Why do you
I
think
mean,
there was a need during the pandemic? Why not any other day?
everybody was stuck at home and needed to find ways to fill their hours. And it actually turned out to be a really good thing for shelters because pets got homes that wouldn't have otherwise gotten homes. It's difficult to manage, balance the different things in our lives and terms of I've got to go to work, but I need to take care of my pet. And COVID-19 took all of that off the platter, and
Mm.
people needed a way to fill their hours in a constructive fashion. Um, Dogs and cats um, weren't part of the pandemic. Yes, I know COVID can pass to animals, but it wasn't like they were making us sicker. So it was actually a really good thing for them to have, a cat in the house that they could work with, or, get out and just take your dog for a walk, or, play a ball with a ball in the backyard. Just a positive thing in the middle of a horrible crisis.
I had one individual that the bond with her rabbit got her through the pandemic. I mean, the love for that pet was just incredible. And then the loss of that pet was equally as overwhelming. But it got her through the pandemic.
Mm-hmm.
And what a gift. What a gift, you know. So after post pandemic, what did you see?
We ended up seeing a lot of dogs with separation anxiety.
Interesting.
They get really used to having entertainment in the home.
Mm,
Not dogs especially will, like people, get really stuck on, oh, I have this entertainment unit in my home who's going to be there all the time, and I don't have to think of ways to entertain myself. And if they learn that young, then they don't know how to essentially fill their own space when they're expected to be alone. And it creates a lot of anxiety. So we ended up with a good portion of pets whose parents needed help to basically restructure that. I've got to go back to work and you're going to be a home alone. And these are the things I've left for you to do to keep you occupied.
mm,
Um, and again, the anxiety meds really helped with that.
okay.
Um, we
Wow.
were very lucky in that we did not see a huge number of people just giving up their pets because their
Good.
lives had changed. The bond is there, and once it was formed, they're not going to get rid of those pets. But we did have to help with some separation
Okay.
anxiety.
Well, that's fascinating because humans also went through that, and the humans separating from their pets, just like with their children, sending them off to school. It's phenomenal.
Mhm.
The war in Ukraine, excuse me. Many of our American veterinarians are over there now giving care to pets,
Mhm.
abandoned animals, zoo animals, administering inoculations so people can flee the country to a safer type of life. What do you think their experience is, these vets?
I hold my hat off to them.
No.
It's like walking out of civilian life into a war zone. And even if they're not directly in danger, they're dealing with all of the emotional trauma that comes from being in a war zone. And unfortunately for them, no prior training.
In
Unlike,
combat, in
yep,
war.
unlike the soldiers on how to deal with the fear and stress.
Mhm.
Um,
I
that
didn't think about that. That's
yeah,
so.
that's gotta be tough because
Hmm.
um, the military does train you on what do you do when these things happen or around you and you're feeling anxious. Who do you talk to? There's a structure, there's a place to go, there's things that you can do, and they are basically out there without that net. So they're going through things that we don't even think about.
I'm just thinking of the 9/11, where a lot of colleagues were there helping out, and they're not the same. I
Yeah.
mean, emergency first responders and so on. We're a bit more prepared, but not for that. But wow. So we really need to think about them, these vets
Yeah. And
overseas. And
they're working in places where there are no supplies. Okay, Dove, love.
oh, look at that. There now, which pet is that? Which
That
cat
is
is
Kaya. That's Miss
Kaya?
Kaya.
Okay. Your best day ever, Dr. Teresa, in the history of your life to date, the best day ever.
That's hard to put a finger on. I'm going to choose one out of many, but one of my best days ever was the day that I earned my expert field medical badge in the Army. That's a badge that you can earn that sets you apart from other military members. It's mostly medical oriented, basically trains you to be a combat medic. So to go out on the battlefield and rescue people who have been injured, um, wearing a red cross on your arm. So you basically become a moving target.
Wow.
But to be able to join that core of individuals who are willing to do that and have the skill set necessary to do that. As a doctor, I thought it would be easy because, they're medical skills, but there's also a lot of other soldier tasks that I had to learn to do that. And I wasn't the world's best soldier. I'm really not cut out to be a good soldier. I didn't have any of the skills necessary.
Oh, I just think it was different. Your talents were
Yeah,
different. I mean,
exactly.
the human factor, there's training and there's, logistics and pragmatics, but the human factor, the animal factor, pet factor, those are things I don't know that those and what you do are a lot, I would imagine, intuitive
Right.
and come quite naturally. And then, of course, you learn all the others, but that's
Yeah.
what makes you the phenomenal individual you are. So if I'm going to ask you, okay, Dr. Teresa Seggerman, describe yourself in one word, what would that one word be?
Giving.
Okay.
My life has been about helping others. And I can't imagine a better life than being able to help others.
And if there was a message to leave for our audience, something that you could tell them, what would that be? Something to leave them with?
Pets are the best thing ever.
Yeah.
No, really, it's the human animal bond. My life has been as amazing as it is because I have been able to spend it celebrating the human animal bond. And yeah, it's really about how much richer our lives are with pets.
And they sense your change in emotion. I can see it, but your little kids there have been crossing and coming closer, and they sense you. They feel us. Dr. Teresa Seggerman, I first and foremost want to thank you for your service, not only as a vet, but as a veterinarian, a doctor of veterinary medicine, and for all you do for our pets and our families. You matter. It's been a privilege to have you on Inside America's Minds. Thank you so much.
Thank you for this opportunity. It's I go through life just, doing my daily thing, but every once in a while, I'm reminded of how much I have contributed to this world.
Yes.
And it just makes me glad that I've been able to.
And thank you for being a part of Erie Animal Hospital here in our fast growing little town of Erie with Dr. Sally, Dr. Gallardo, and that wonderful staff. Thank you so much.
Thank you.
Godspeed.